The first step in determining if you're a candidate for the LASIK procedure is to have an initial screening and answer a few questions at your regular eye care visit.
Hi Jennifer, my name's
Once
Donna.
it's determined that you are a candidate, you'll schedule an appointment to come in and see a refractive coordinator.
I read their glasses, explain the difference between wavefront LASIK and standard LASIK, explain what LASIK is and why it works for their visual need.
She's going to do some testing to look at the optics of the eye, the power, and some other criteria just to make sure that everything is within normal range and that we can safely do the procedure on the patient.
If everything checks out and the health of the eye is good, you'll be able to schedule an appointment for a formal examination with a surgeon. Here, you'll undergo a dilated exam where the doctor will check the health of your eye.
We're also checking to make sure that there isn't any significant dry eye, because that can be a problem for any kind of eye procedure. So if we do see signs of dry eye, we'll want to get that under control before we actually do the procedure.
The doctor will also go over specifics involving the LASIK procedure in case you have questions. You'll also schedule a date for the surgery at this time. Before you leave, you'll be introduced to an online interactive tool that you can explore from home. This allows you to walk through the procedure step by step and ask questions.
We give them some pre-op instructions ahead of time. They'll start some antibiotic drops the day before. If they've been wearing contacts, they'll need to be out of them for about a week before.
On the day of your procedure, it's important to arrive wearing no perfumes or makeup, as they can interfere with the accuracy of the laser. Shortly after you check in at the front desk, the nurse staff will give you some relaxing medicine. You are encouraged to eat and drink prior to coming to your appointment, as it is best not to take the medication on an empty stomach.
Before you ever enter the LASIK suite, we give you oral Valium. It's a mild sedative just to make sure you're calm. It's important to be calm during the procedure.
Pain is probably the biggest concern that they have, and patients tell us week after week after week who have had LASIK surgery that it didn't hurt. They're always surprised. We do try to make them as comfortable as possible and try to keep it more like a treatment rather than a surgery.
Just before the procedure, a nurse will apply some cleansing agent around your eyelids. You'll then be able to relax for about 60 minutes inside the Zen room with soft music, low lighting, and comfortable massage chairs. This is unique to the Ocala Eye LASIK experience and allows the patient to relax in a calming environment before starting the procedure. When you enter the procedure room, you'll notice two lasers. The first is the Femtosecond Laser, which is the technology used to create the thin flap of tissue in the cornea without discomfort. The Femtosecond Laser is also the latest technology being used in cataract surgery. The other laser in the room is called the Excimer Laser, which is used to perform the refractive procedure or correction by removing a small amount of tissue from underneath the flap and is completely painless. During the procedure, the doctor will frequently apply numbing drops. The entire process takes less than 30 minutes for both eyes.
The success rate with LASIK is 99+% of people are going to see well without glasses or contact lenses after the procedure.
Immediately after, most patients are able to look across the room and see the clock on the wall. It's a little bit fuzzy still, and there's a little gritty sensation.
Another unique aspect is that Ocala Eye is the only LASIK center in the area that provides a dedicated, climate-controlled laser suite. It's important because temperature and humidity levels can have an impact on the accuracy of the laser, affecting outcomes. Once the procedure is finished, the doctor will give a final check and send you on your way. Because of the relaxation medicine, you will be required to have another person drive you home.